I think the Scholarship Gala serves so many different purposes. It brings us together as a community. Faculty, staff, students, friends, family, our alumni, and very importantly, our partners, our affiliates, the hospitals.
We are very, very special in the way that we take the undifferentiated student and we bring them into our school and we give them opportunities to excel in whatever area is important to them. They can become researchers even if they came to our medical school not having majored in science. They can become real community advocates and work in areas where they're underserved. They can really hone their skills as medical educators and hopefully be able to go out and create more doctors.
I'm really grateful to have received a Gala Scholarship because I plan to pursue a primary care field, probably general pediatrics. I was recently on an elective with Dr. Alpert, who's a pediatric cardiologist. When a child comes in, we take the time to find out exactly what it is about the symptom that's bothering them, if they're having other symptoms, a complete history including family history, always checking about the parent's heart. The children get a complete physical exam, mostly focusing on the cardiac exam, listening to the heart, checking for pulses, always checking for pulses in the upper and lower extremities.
I think I was always interested in medicine. I can remember as a little kid, like being 3 or 4, asking my parents for first aid supplies for Christmas, of all things. And as I got older and in high school, I started lifeguarding, and I got to teach CPR and do some of the first aid. And then in college, I became an EMT. And in the summers, I'd work at the emergency room in my hometown. So I guess I really liked the blend of science and the knowledge that it required, but also interacting with people and being able to make that connection and share that sort of moment and try to make even the smallest difference when people are in a vulnerable position.
Teamwork is an essential part of medicine, and it's definitely emphasized in our medical education. Frequently in our patient-centered medicine class, we have 3rd and 4th year students come in and teach us the basic manifestations of diseases and how to conduct physical exams. Furthermore, in our coursework all the time, we have small group sessions where we all have to work as a team to solve a problem, and then they further subdivide us to go and teach it to our classmates. So our education is certainly focusing on the whole work together, solve a problem, and then go forth and teach it to others.
Volunteering at Massachusetts General Hospital was very insightful, and I think the first point where medicine was a very serious option for me. I would go and I would observe the physician-patient relationship and how important that was in any clinical scenario, that the physician and the caretakers and staff were able to bring a sense of peace into the room. It was pretty profound to have witnessed that, and I think a very powerful impetus for me to pursue a career in medicine.
When I had the opportunity to see the students' elation regarding the receipt of the funds that we were able to provide them, there was nothing more rewarding that I could ever imagine than that.